Okay, anxiety disorders are extremely important given that they are the most common of all the psychiatric disorders. When you think of anxiety disorders, you have to remember that the classic anxiety disorder patient is going to be a young woman who has genetic loading. So someone in her family has either A, that disorder, or B, a very similar disorder. And because anxiety disorders are the most common of all the psychiatric disorders, just imagine what the most commonly prescribed psychiatric medication would be. And that, of course, would be the benzodiazepines because they are used routinely to treat anxiety disorders. Now, when we think of anxiety disorders, what is it that we're basically thinking of? We start off with the definition of what is anxiety. Anxiety is a syndrome where you have both physiological as well as psychological components. When we think of the psychological components, it's those uneasy feelings, that feeling of apprehension, that feeling of worry, that feeling of dread or doom that something horrible is going to happen. When you're thinking of the physiological components, what you're thinking of is the autonomic hyperactivity, that shortness of breath, the diaphoresis, the palpitations, the tremors, the quivering voice. When something makes us nervous, how do we feel? When we get our grades in the mail and you're holding that envelope, what's happening? Your hands are shaking. Your mouth is dry. Some of you feel like you're going to die. Some of you feel like you're going to pass out. Some of you have to rush to the bathroom. That is the combination of the physiological as well as the psychological components that all of the patients who have anxiety disorders typically exhibit. Now, what are the theories of the anxiety disorders? One of the theories is purely psychodynamic, and of course this is Freudian in nature. And what the theory was based on is the following. If you do not let the instinct get through, then you're going to have anxiety. That's a common theory. Luckily for you, it never gets asked, so let's move on. Behavioral theory is also a very common one. What we're trying to think of in behavioral theories is that you have learned to become afraid of certain situations. For example, you're small. You get bitten by a dog. Is it possible for you to not only become afraid of a dog, but become afraid of any dog? Yes, it is. Let's say you're going to class one morning. While on your way to class, you develop a panic attack. Because of the panic attack, now you're afraid of going to class. So now you have one anxiety disorder leading to another anxiety disorder, and it was purely learned. And usually when you have behavioral types of anxiety disorders, meaning those that were learned, the treatment of those will be behavioral therapies. For example, the phobias, you don't treat them with a medication, but you treat them with behavioral therapy. Another reason for anxiety disorders is the neurotransmitter theory. Anxieties are associated with certain neurotransmitters, and those would be norepinephrine, serotonin, and GABA. How do we treat anxiety disorders with SSRIs? How do the SSRIs work? They work by inhibiting the reuptake of serotonin. You also treat them with tricyclic antidepressants or SNRIs. How do those drugs work? They work by adjusting the levels of serotonin and norepinephrine. And we also use benzodiazepines in the treatment of anxiety disorders. Why? Because the benzos work on GABA. GABA, you know, is the major inhibitory neurotransmitter in the brain. So therefore, the benzos are given to increase this. So the treatment of choice for anxiety disorders will usually be antidepressants and benzos. Given the choices of the antidepressants, the SSRIs would be the ones that would be used most frequently. Now, looking at specific areas of the brain, where do we find most of the serotonin? It's found in the raphe nucleus. And where do we find most of the norepinephrine? It's found in the locus coeruleus, and now you understand why those areas are implicated in the treatment of anxiety disorders.